In systematic reviews, formulating a structured research question is the first step. Let's explore the components of a structured research question and its significance in systematic reviews. In systematic reviews, formulating a structured research question is essential for guiding the review process and ensuring clarity and focus. So let's start examining the components of a structured research question. A structured research question usually consists of the following key elements, which we can call PICO in short. P, which stands for population, means the target population or group of interest, such as patients or people with a specific condition or diagnosis or characteristics. I, intervention, which means the treatment, the exposure, or diagnostic test which is being investigated. C, which means comparator, which includes the alternative treatment, exposure, or diagnostic test that is used for comparison. O, which stands for outcomes or endpoints of interest, such as clinical outcomes or surrogate endpoints. T is optional, which represents time, the time horizon over which the outcomes are being assessed. Clearly defining the structured research question, systematic reviews enhance transparency, reproducibility, and their validity. This structured approach will enable researchers to systematically identify, select, and synthesize relevant evidence, and ultimately facilitating evidence-based decision-making in healthcare. So this structure of PICO can be applied for different types of reviews: therapy, prevention, screening, and diagnosis strategies, which in essential they are the intervention of interest. For However, for systematic reviews focusing on intervention strategies, usually we will limit our scope to RCTs. Now let's look at an example of PICO research question. Should tobacco-dependent adults receive an extended or a standard duration of treatment? So the P, the population of interest here, is tobacco-dependent adults. These individuals represent the target group for whom the effectiveness of different treatment durations will be evaluated. I, the intervention under consideration is an extended duration of treatment with controller medications, including nicotine replacement therapy, varenicline, and bupropion. The comparator, the C, in this example is the standard duration of treatment with the same controller medications. The O, the outcomes will be measured in terms of cessation rate, relapse, and the adverse events. Of all, the primary outcome is the effectiveness of treatment, which is smoking cessation. By defining population, intervention, comparator, and outcome, we can set the scope of the systematic review and define the eligibility criteria accordingly. PICO is very useful, but it cannot be used in every case. Systematic reviews could answer various types of research questions, and let's explore the common types of research questions before we move to another format. The first type is therapy and prevention. So these reviews assess the impact of specific treatments or interventions on patient outcomes, on disease progression, or prevention of health conditions. The second type is diagnosis and screening. So these reviews assess the performance characteristics of diagnostic tests in identifying the presence or absence of particular disease, such as sensitivity or specificity. Or these reviews can also assess the benefits and harms of screening programs. The third category is about causation. So these reviews explore the association between potential risk factors and the occurrence of the disease, helping to elucidate causal relationship and inform preventive strategies. The fourth category is prognosis. These reviews examine factors that influence disease progression, treatment outcomes, and long-term prognosis, helping clinicians and patients in making informed decisions about whether they should treat or not. Each type of research question requires a tailored approach to systematic review methodology. By addressing a diverse range of research questions, systematic reviews contribute valuable evidence to inform clinical practice and policy making. And usually, PICO format could be applied to all these different type of research questions. But there is another format. Another format for formulating research question is the SPIDER format, which is particularly useful in qualitative studies. Now let's see one example. What are the experience of patients with chronic obstructive pulmonary disease using inhalers? The S component represents sample. So who are the participants in this study design? In our case, it is patients with chronic obstructive pulmonary disease, COPD. This component specifies the target population and their characteristics. The second component is phenomenon of interest, PI. The phenomenon of interest in our case example is COPD patients who are using inhalers. So this component focuses on how and why of behaviors and experiences. The third component is the design. How the study was devised and conducted. The design of the study involves a qualitative exploration of patient experience and perceptions in our case example. The fourth component is E, evaluation, how the outcomes or experiences was measured. The evaluation component aimed to understand the impact of inhaler use on COPD management from the perspective of patients. The last component is R, research type. So we need to specify, is it qualitative, quantitative, or mixed? In our case, this is a qualitative. So the SPIDER format provides a structured framework for formulating qualitative research questions. And when we cannot use PICO to format a research question in a quantitative manner, then SPIDER format could be very helpful.